if I have to put it in a nutshell, nutrition, sleep, stress management, and exercise, these are some of the problem areas. We have a carbohydrate predominant food pattern, eating all through the day, like multiple hits of food, snacking, 5 to 6 small meals. And look, if eating 5 to 6 small meals is giving you your ideal health results, I don't have a problem. But if you are eating multiple small meals and multiple snacks late into the night and you're not feeling the health results, a very likely connection there is the insulin. You're continuously hitting the body with insulin. Your body's just not getting a time to do other things besides digesting your food. Like I mentioned about protein deficient diet. Now, what happens? With all that, you get this downhill domino collapse of systems. You have high insulin, you have leptin resistance, which means your brain is not getting the signal of I'm full. Your brain is saying, I'm hungry, I'm hungry, I'm hungry. Even though you've eaten, your brain wants more. And you're feeling tired, you're feeling low energy because insulin is keeping all that energy locked away. Why? Insulin's job is to put things into storage. Insulin, as long as high insulin is around, it's going to be like that security guard standing outside the bank, not allowing you to withdraw your funds, your own funds. That's insulin's job, is to store things for a rainy day, store things for energy shortage periods. So it's the energy storage hormone. So as long as you're busy storing, it's not going to make the energy available for you in a liquid or a liquidated, easy to spend format. So then you feel low energy. What do? You reach for food because you think, oh, I need energy, so now let me eat food. And guess what happens? You have more insulin coming. That sets up a vicious cycle, and that's why people end up being stuck. So if you have been stuck in terms of fixing your nutrition, not getting the results, not getting metabolic improvements, this is a very likely place to look. What about sleep? Poor sleep directly worsens all of these conditions. You probably know this already. You've noticed that you fall sick on nights or weeks when you've not been sleeping well. You don't get the benefits of growth hormone at night. Even if you've worked out today, you're not getting the benefit overnight. Athletes, professional athletes, invest in 7 to 8 hours of sleep and hire expensive sleep coaches to make sure they get natural, good squirts of growth hormone in deep sleep to build their muscle without getting banned for being caught for doping, right? So natural growth hormone comes from deep sleep. Without growth hormone, you're not going to get that muscle benefit. If you don't have muscle benefit, you again have the same insulin resistance problem if you're not exercising or you don't have enough nutrition to give you the results of your exercise. What happens when you don't exercise? You don't get the endorphin boost or the antidepressant, right? So exercise is the most natural antidepressant there is with no side effects. If you don't do that, your brain suffers and you will not be able to cope with your stress as well. Those who exercise generally find they're able to manage stress in a better way. It sort of gives you an athletic mindset. Sleep and stress are tied together. When you're not sleeping well, you're more stressed. When you're more stressed, you're not sleeping well. Another vicious cycle. A lot of these arrows you can see are like turning into convoluted loops where there's no escape out. Again, when you have not learned from today's day and you go into the next day without learning from today, you're probably going to make similar mistakes tomorrow. That's going to then backfire, and your poor learning is going to trigger stress, and stress is going to trigger poor learning. Stress directly raises insulin resistance, lowers immunity. We know this. The stress hormone cortisol, it's supposed to be released in short bursts when you're running from tigers and being attacked by a swarm of bees in the jungle. Okay, it's not supposed to be high all the time because of financial issues or relationship issues. It's not supposed to be all the time high 24/7. It needs to come back down to baseline. But chronic stress means our body's fight, flight, fright system is just not coming back down to baseline. What else do we do when we're stressed? A lot of us resort to emotional eating because food is your best friend. It doesn't complain. It's a soothing, comforting thing to do. And that's how we cope. Instead of getting into a fight or escalating into rage or pushing our emotions out into the world, sometimes we use food to bury our emotions. And that again sets up another vicious cycle. And if you gain weight, you start feeling bad about yourself, you're low self-esteem, low confidence because you're not feeling okay physically. And again, another vicious cycle.